Hi everyone, my name is James and I'm a UNCP nursing student, and today I'm just going to be talking with you guys about physical activity for clients in the inner 70s. Alright, so let's get started. This is a project that we are doing for our health assessment course for the nursing program. So just to give you a little bit of overview, this is to provide information on how important physical activity is to the older adult. Significant health benefits are seen in clients over age 65 who incorporate physical activity into their days. Before you actually start going into, doing physical activity, you want to look at your health condition, your personal health condition, and how you feel on a daily basis, to determine whether or not or how much physical activity that you can engage in. So you want to evaluate your personal condition, your own condition, and also you want to consult your doctor before you decide how much physical activity you wish to engage in. There are certain chronic health conditions such as COPD, hypertension, among others, that should be taken into consideration. These can decrease the amount of physical activity that you are actually able to perform. And again, this is where you should come talk to your doctor about how much physical activity that you should be doing each week. There are specific guidelines as to how much is recommended, but due to health conditions and other things, it may be specifically tailored to meet your body's needs. Now there are different activities that you can incorporate, and I'll go through each of them. But just to give you kind of an overview, they are aerobic activity, muscle strengthening activities, and balance training for older adults who are at risk for falls. All right. The next thing I want to talk about is the inactive adult. You want to remember to start slowly. You don't want to just jump up and go try and do a crazy exercise, at all at once, because you have to give your body time to get adjusted. Another thing is when you just hop up quickly, it causes orthostatic hypotension, which is a immense drop in your blood pressure, like all at one time, which can increase your risk for falling. So what you want to do is you want to aim for light or moderate intensity for short periods of time. You want to make sure you spread out the physical activity several times throughout the week. So you don't want to do all of your activity at one time, in 3 days in a row. Spread it out. So maybe Monday, Wednesday, Friday, Sunday, Tuesday, Thursday, whatever you feel comfortable with would be the best thing for you to try. So, start out slow. If you want to, start out just doing maybe 2 days a week, then do 2 days a week. And as the time goes by, if you feel like you can do more, increase to 3 days a week. Again, it is all tailored to your body and how you feel that what you can do. Again, consult your doctor if you have a chronic health condition, or if you notice symptoms such as chest pain, headache, tachycardia, which is a high heart rate. If you notice any of these symptoms, then contact your doctor. Stop exercising. Talk to your doctor about it, because it may be too much for you. Next thing is this is a very important part to exercise. It's called the warm up and cool down process. Warming up is a process where you actually do just some light jogging or some, slow or brisk walking before you begin any kind of exercise regimen. This helps to prevent injuries and reduce muscle soreness. So it kind of, in a way, it loosens your body up, getting you ready for the exercise that's actually going to be meaningful to you. And after the workout, you want to gradually lower the intensity to cool down. So, when you know that you're about to finish your workout, don't just stop it. Don't just stop abruptly, because that can cause injuries and it can cause you to have a lot of muscle soreness. So what you want to do is just slow your workout as you're coming to the end of it. Just slow it down and then stop. And that way you don't cause any injury to your body. All right, so we're going to talk about now the first one, which is aerobic activity. This is known as endurance activity. And some examples are brisk walking, jogging, biking, dancing, and swimming. Older adults should aim for at least 150 minutes of moderate intensity activity and 75 minutes of vigorous intensity activity each week. So kind of break it down a little bit. Moderate intensity just gets the heart rate up with the increasing activity. Vigorous and intensity increases the heart rate and can cause a lot of sweating, and that's where you're going to burn the most calories. It's during vigorous, hard exercises. Again, if chronic conditions occur, just try and do what you can. Don't overdo your body. You know your body's limitations, so just don't overdo it. Again, start off slow. So older clients should try and exercise at least 3 times a week to avoid muscle fatigue and reduce the risk of injury. So when you start exercising, don't stop abruptly, and just quit. Don't exercise for 2 weeks and then just quit, because it's not going to be good for your body. Your body's going to have gotten used to you exercising on your regimen, and as your body's going to expect that. And if you don't, that can cause muscle fatigue, especially when you go to restart your exercise, and you're going to have to go through the whole, soreness thing again, because some people, when they start exercising and they haven't exercised in a long time, they end up with the soreness and the muscle fatigue. So if you don't, go through and kind of keep up with the exercising, then you may notice that. Okay. The next one that we want to talk about is muscle strengthening. So muscle strengthening for older adults, you want to try and do it at least 2 days a week. But again, don't overexert yourself. Don't overdo it. So muscle strengthening should include all of the major muscle groups: legs, hips, the back, shoulders, arms, chest, and the abdomen. Things that involve muscle strengthening would be using exercise bands. So the little bands that just come out. You can use the ones that you use your feet with. Also your weight machines. So if you go to a fitness centers oftentimes have weight machines that you can use. And they also have handheld weights. So the little 2.5 pound weights or the little 10 pound weights, you could use those as well. So one thing that you can do for muscle strengthening is while you're at home, if you like to garden, you can, if you're digging a hole for your flowers, or you're lifting the pots, lifting the tools, or carrying anything, that's muscle strengthening. A lot of times we don't think about small things like that being part of muscle strengthening, but it is. We don't think about it as exercise, but it is. And then there are some yoga exercises, and then everyday things such as carrying groceries. Carrying groceries is also muscle strengthening. And the last thing that I want to talk about is balance activity. So older adults that are at risk for falls should focus on these activities that increase balance and coordination. Increased risk of falling increases when older adults have trouble walking or have had falls in the recent past. And the guidelines recommend doing this at least 3 days a week. These are just some simple activities such as walking backwards, walking to the side, walking on your heels, walking on your toes, and then standing from a sitting position slowly. So those are just some simple exercises that you can do to increase your balance. That'll make it easier when you're exercising so as to not lose balance and fall. It also increases it just for everyday walking, everyday going, because you don't want to be sedentary and just letting your body, you know, just sit, because then your body's not going to get used to walking, and it's going to be hard for you because you may end up falling, and we want to avoid that as much as possible. So that's pretty much all I have for you. The information in this PowerPoint that I created came from the article written by University of Nebraska Lincoln. It's titled Physical Activity for Older Adults, and it also came from Healthy People 2020, which is they have a wonderful website that gives information and guidelines and stuff on, how to stay healthy, what are some recommended guidelines for eating and exercising and activity and everything. So that's where I got my information from. I just wanted to thank you for watching my video, and I hope you learned from it, and I hope you can take this information and go out and exercise.